Morning. My name is Justine Adams. Great. Thanks, Anna.
Yeah, you do.
Perfect. And yeah, I'll just be kicking off kind of briefly this morning, just setting a bit of context around multiple disadvantage. I'm sure everyone on the call is here because they already know about it and they're interested. But yeah, I'll just set the scene. So if we could have the next slide, please. And I should say, sorry, my name is Jessie. I'm commissioning manager within Sheffield and also the Changing Futures program manager in Sheffield as well. Thank you. So the definition there is our local kind of definition in Sheffield. Obviously, nationally, the definition of multiple disadvantage is experiencing 3 or more out of the following areas: so homelessness, substance use, poor mental health, contact with the criminal justice system, or a victim or perpetrator of domestic abuse. When we consulted locally in Sheffield around the definition, partners wanted to add in that last sentence around the combined effect of those, and that it places an individual at risk or remaining at risk of further harm, trauma or institutionalisation. And recognition of the wider challenges that someone experiencing multiple disadvantage may face also includes physical health conditions which impact the quality of life, removal of children, acquired brain injuries and poverty. And also, I've just put in there around the NHS England's health inclusion framework that identifies kind of additional kind of groups where multiple disadvantage kind of intersects with some of their experiences, such as vulnerable migrants, refugees and asylum seekers, sex workers and victims of modern slavery as trafficking, as having additional vulnerabilities due to the exploitation that they may experience. Next slide, please. So when not only just looking at multiple disadvantage in isolation, but as I kind of alluded to before, it's the interlocking nature of all of those kind of component areas of need and their cumulative impact, you know, rather than necessarily one of them being particularly severe and the 4 others, for example, being less severe. And it's that combined effect that has that kind of significant impact on the individual. For example, like particularly when it comes to offending, so someone who's experiencing multiple disadvantage might not be known to commit the most serious offences in terms of violence to the person, for example, but it may be more consistent with low-level offences that results in that revolving door, kind of in and out of prison, community sentences, and that leading to that disrupted lifestyle. So being kicked out of accommodation because a temporary or supported accommodation because they receive a sentence that's longer than 14 or 16 weeks, which then results in them being homeless when they come back out of prison. Trauma and ACEs, so obviously goes without saying, speaking about multiple disadvantage, but that significant kind of trauma in childhood and adolescence contributing to that individual's poor mental health and state of mind, and subsequently leading on to things like addiction, for example. And the isolation and stigma, so like I said about how the multiplicity and the interlocking nature of it, because of that and because of the disadvantage experienced in such a broad range of areas, the level of stigma and isolation from society really compounds that individual's experiences. And across all of this, obviously talking about women today, is the gendered lens on top of all of that. So that's something that we're going to be exploring in more detail today. What I thought I would do, I'd just do a recap of some of the existing reports that talk about the prevalence of multiple disadvantage. So got 3 kind of different sources there. In Sheffield, data work that we did estimated around 3,000 people were experiencing multiple disadvantage, so experiencing 3 out of the 5 areas. Likely to be an underreporting for various kind of data quality issues, and approximately about 10 to 15% of those individuals require more support. So they're severe kind of multiple disadvantage, experiencing 4 or 5 out of the areas of need, but existing kind of mainstream services aren't quite fitting the bill for them. They need a more tailored approach. The Hard Edges report from 2015 estimated that the average local authority had about 1,500 multiple disadvantage cases or individuals per year, but that did not include domestic abuse at the time. So the Gender Matters 2020 report sought to address that and look at women's experiences in particular. And from data from 2010 to 2014, that was the 336,000. Yeah, was the estimate that they had in 2020. And it was estimated that out of the individuals experiencing all 4 areas, so yeah, that they looked at, about 70% were female. So in some of the previous, like Fulfilling Lives programs, for example, predominantly more of a male cohort because domestic abuse wasn't included. Now that we've got Changing Futures, where domestic abuse is very much included, the average gender split is more 50-50 because of that. So it's far more representative of the cohort's experience. So I'm going to pass over to Eleanor from Solace Women's Aid.
Yeah, thanks, Justine. Yeah, hi everyone. Thanks for having me. I'm Eleanor. I work at Solace, which is a women's organisation based in London, and we, alongside lots of other fantastic organisations, co-deliver the Women's Rough Sleeping Census. Amy's going to talk after me about the kind of local delivery of it in the last year or so and how that's gone, but I just wanted to give a national overview and explain a bit about what the Women's Rough Sleeping Census is and how that make it clear how that links to multiple disadvantage as well. So women's homelessness, I think a lot of us associate women's homelessness with what's often called hidden homelessness. We know that it can take visible and also less visible forms, for example, sofa surfing, domestic abuse, and other forms of violence against women and girls, sex working, exploitation and trafficking, refuge and charity funded support. You know, often women going into refuges won't be recorded as being homeless in statistics, but they're very much experiencing that. And then there are often a lot of informal arrangements as well that can include separation from children, again, that might go unrecorded and not seen by services or not supported by services. In particular, though, women's rough sleeping can also be much less visible than other forms of homelessness and other forms of rough sleeping. So what women might do is end up walking around all night rather than sleep or bedded down in a doorway or anywhere like that. Might also shelter in concealed locations to make sure they're not seen by people who could harm them. In A&Es as well, for example, McDonald's and other places that are open 24 hours, train stations and so on. And they might also conceal their gender, again, for safety. So in statistics, you might not actually see as many women as there might be, and services might not be aware. And also women might be sex working at night and not really have anywhere to stay during the day. But again, that might not be picked up by services and that they're still experiencing this, and they might not recognise that they can get support for that as well. And many women also stay with strangers as an option instead of the risks of rough sleeping. I have to make that really difficult choice between which feels safer. So all of these forms of rough sleeping might not be visible to services, and if they're not visible to services, they're also not visible, unfortunately, in statistics, which do have an importance in how we, as Justine was just talking about, how we present, how we think about policy, how we provide services for women. Women can also alternate between lots of different forms of homelessness, whether hidden or visible. This means it might be harder to offer consistent support within current systems or see women if they're consistently moving between different forms of homelessness. They might be seen in one place and then not seen again, or they might not be seen at all. And of course, these really heavily interlink with experiences of severe and multiple disadvantage, particularly for women who are rough sleeping and who've been doing so for quite a long time. What's the impact of this? Why does it matter? Why is it important? So the current data collection on rough sleeping and homelessness that happens nationwide, and the way that we structure services and processes and the way that people can access support and services, especially around rough sleeping, can mean that a lot of these experiences go unseen, unaccounted for, and also unsupported. If women aren't seen in the statistics, then we're not including women in the service provision or the policy that we provide. If women aren't seen by services, they might not be able to get the support that they need. Another impact, women can also feel uncomfortable accessing services, for example, due to lack of trust, high levels of male attendance, for example, in homelessness day centres, which can make women less visible and less able to access, so they might not come to those services. So again, that might be a route where they don't take, and so we don't see them and women don't access the support. As I say, the impact of that is that women are then underrepresented in commissioning and designing services, in funding for services, in policy and practices. And that means that they aren't designed for women and there aren't enough services for women. So those day centres, the services that we need, the accommodation types, if we're not aware of how many women there really are experiencing this, then we can't provide those services in the right quantities or in the right design. This ultimately means that women are remaining homeless and safe and in need for much longer than necessary, sometimes resulting in lifelong or entrenched homelessness and disadvantage. And the longer that someone is experiencing that, the further they get away from the services, the more increased and the worse their experiences of multiple disadvantage can become, and the higher their needs, and the longer it can take to resolve and recover from those. But better than I can explain it, we've got a video that has some quotes from women who have completed the census and told us what it's like for them, what they've experienced. So I just wanted to play a short extract of this, it's a much easier to hear and understand what women are experiencing when we hear it from themselves. I'm just going to play this for a couple of minutes, but please let me know if you can't hear it. And it's women talking about difficult things that they've experienced while rough sleeping. So please, if you need to take a minute or you're not comfortable with hearing it, please do just feel free to step outside or just mute the sound or anything like that. Thank you.
Women are not safe on the street. Women are easy targets for other homeless people and the general public.
Sleeping rough is the scariest part of my life.
As a female, I feel so vulnerable. Sometimes I feel so scared to sleep outside in case of anything would happen to me. I feel people look down at me most of the time.
I feel scared. I had to find place on the streets to hide. It's terrible on my mental health.
I could run around and travel on buses. As a female, you can just go to the corner of a road and sleep. It's not safe.
I hate feeling like I can't go home.
Because I'm transgender, I face mental, physical and emotional abuse. I actually never feel safe anywhere and I'm constantly on the move.
The first time I slept rough, I was approached by a number of men. Most recently, I was sleeping in a tent with a man who was coercive to me and attacked me.
So I'll make sure that video is shared. Unfortunately, we don't have quite enough time to play the whole thing, but you can see the link. But we're really grateful to the women who shared their thoughts on this with us, which is amazing. And also it's really insightful to hear about what women's experiences are and how it impacts them. And of course, this interrelates with experiences of violence, as many people mentioned, substance use, particularly as ways to kind of cope with those experiences, as well as experiences of criminal justice, having children removed from care and so on, and those interlocking factors that Justine mentioned. So why a women's census? So because of all of that, we wanted to make sure that we could reach women who rough sleep in different ways. So we designed a census that could hopefully try and do that and improve methods to do that. We also wanted to make sure that we ask questions to understand and improve our understanding of their experiences. At the moment, often data collection is about numbers, and we wanted to make sure that we were speaking to women. We don't have enough evidence, it's not well heard enough about what those experiences for women are. So we wanted to make sure we were asking them those questions to improve that. We wanted to make sure our approach was gender informed so that we could reach women who were experiencing things in different ways, and so that women could feel safe and able to talk to people and also make those first initial contacts with members of staff who could continue to support them. We also wanted to gather data across sectors. We know that women are experiencing multiple co-occurring needs, and therefore it might not be a homelessness service that they reach first. They might be accessing a health service. They might be accessing a drug and alcohol support service or women's service or so on. And so they might never reach a homelessness service. So it's really important that we expand our data collection across those sectors to make sure we're really understanding how women are approaching and how many women there are experiencing this. And ultimately, we wanted to capture the learning and push for change. We want to do that at a local level so that we can see practice change actually influencing and making a difference for women, but also national change about those systems and structures that are continuing to miss women so that we can better reach women who sleep in different ways and continue that cycle. So some of the things that we did, I'll just go really briefly over this rather than in detail, but to make sure that we were kind of trying to do all that and changing methodology so that we were trying to better reach women. What we considered was a challenge that women are less likely to be down visibly on the street. As we mentioned, they might have all those differing and wider range of experiences as there can be a lot of risk to women on the street. So that means they might not be seen in rough sleeping counts, they might not be verified of rough sleeping. So we created guidance about gender-informed outreach that different places could, different teams could enact and plan based on their local area, thinking about different places that women would go in, different locations to look in, but also different times to think about as well, as we know that women might not be seen at night or might be less visible at night. For example, if they're walking around all night, it can be hard to identify someone as rough sleeping in that situation. We also know that women's patterns of rough sleeping are transient and intermittent. So using a single night count, which we do for national kind of annual data collection on rough sleeping, means that we're likely to miss or underrepresent women because they might be in one place one night, another place another night, or they might be sofa surfing on one night, they might be kicked out the next and have to stay somewhere outside, but often having to move on from different positions, move across boroughs, or change their, how they're sleeping and where they're staying each night. So our data collection expanded to be across 7 days in terms of actual data collection, and also about the past 3 months rather than what was happening for them on that night or on that day that they were seen. Ideally, this would then influence data collection across the whole year. We just had to use a short kind of period of time just for the research and practice methodology experience as well. Again, as I said, we mentioned a wider range of services, so we wanted to include those. And we also, as I said, wanted to make sure that we're asking questions to better understand their circumstances rather than just noting the numbers of women down. So how does the census actually work? So the first part of it is a census survey, which is 10 questions. It's designed to be completed with women who may have been experiencing rough sleeping recently so that we can understand from them what's happening for them and ask them the specific questions about their experiences. And that's conducted on gender-informed outreach, but also by those other range of services who might not do outreach. The second part of the census is a local insights meeting, and this involves a range of services coming together across an area to submit the numbers of women that they support across the 3 months. So again, that might mean that women who aren't met to do the survey, but services know about and want to make sure are recorded and represented, and also discussing key challenges that they face in supporting women in their local area. What services are they lacking, and what support are they lacking to be able to effectively support women? So we've been doing the census now for 3 years. We started in 2022 with a pilot version just in London. Then we expanded nationally in year 2. And last year in 2024, we expanded even further to cover lots of different areas across England, which is fantastic. That means across all 3 years, we've now reached 2,000 women who've completed a census survey with us. That's 2,000 women who from their answers, we can tell have been rough sleeping in the past 3 months and have completed a survey and told their experiences to a worker, which is a huge amount of data that we've never had before. In year 3, 88 local authorities took part, which is fantastic. We've still a way to go. There are 317 local authorities in England, so we'll keep going on that, but it's amazing to have all that participation. In the 2024 census, 1,114 women completed a census survey and were found to be rough sleeping within the past 3 months. And 41 of those 88 local authorities conducted local insights meetings in that year as well. I'm not going to share all the data about 2024 census, but we'll have a report launch coming up where you can hear more about that detailed data across the whole country, and Amy's going to talk more about the data for the local area as well. What we've found that researchers kind of really key findings from this is that women's experiences do tend to be hidden, transient and intermittent, and they do fall outside the government definition of rough sleeping. So we found that from those experiences that we have, and that we've got recorded, we know that actually women are being missed by the current processes that we have. Researchers also found that a third of women were previously in homelessness accommodation before they were rough sleeping or before they returned to rough sleeping, which shows us that there's a lot of work to be done to make sure the provision that we already have is actually effective for women. So this is an example from the 2023 census to kind of show how the data can be useful, even just on a numbers perspective. So the government rough sleeping snapshot, for example, in Greater Manchester counted 5 women across all 10 boroughs of Greater Manchester. But the census in 2023 found 188 women through that survey. So that's a huge difference that we can really see, you know, that's much more information that we have that we can use to plan and deliver services, and shows that the techniques used to try and reach those 188 women are more effective for women than the techniques used to reach those 5 women, which is really important for ongoing thinking about practice and how we reach women, how we support women, as well as how much support we need for women as well. So the census allows us to build up this evidence, more evidence than we've ever had before, but it's also about much more than numbers. As I say, we talk to women, the practitioners go out and have those conversations with women, but also the information that we get back can be used in lots of different ways. So for example, in a relational sense, it can improve relationships and collaboration across different services in an area and across different sectors, but also services have reported that they've got improved relationships with women and the practitioners who completed the census. So that's really important for, again, ongoing practice. We also see services and practice changing. So we see new women's accommodation services opening, new women's services, new specialist roles, new multi-agency case conferences that can support women, and different national impact as well, and local impact on new policies and new commissioning practices, and putting it onto the agenda at strategic and operational levels, and talking to the government about what this means and how this can be supported from a national government level. So an example of how we do that in terms of kind of national advocacy and lobbying, what we've done this year is put together a Women's Rough Sleeping Census Manifesto for Change to try and influence the MHCLG's new national strategy for homelessness, which we hope will be coming out kind of maybe in the summer, but sometime this year. It's currently being written. So we, from the data that we've got from the census, summarised 5 steps and provided a bit more detail about those, about how we can tackle women's homelessness. And how that can be supported through the strategy. So that's kind of what we do as advocacy, taking all of this data on a national level. So I can share this with you, but just to kind of outline the key overall categories that we put into that manifesto. Firstly, it's about a definition. We said that the homelessness strategy needs to be configured around an understanding of how women experience homelessness and rough sleeping. We need to change that definition so that those experiences that I've mentioned about for women, rough sleeping, can be included. Data, we said that the government should provide local authorities with tools and resources to ensure that they gather accurate and inclusive data on women's homelessness through doing the annual census, the women's census, but also year round. Equity and safety, we said that the government should provide guidance and ring-fence funding to enable local authorities to ensure that their homelessness services and systems are equitable, accessible and safe for women. So that's about making sure that new services are gender informed and are safe for women, but also that existing services can be improved to make sure that they are also safe for women to access. As we hear many reports from women saying that they don't feel comfortable accessing a lot of services, and clearly from the data that we've got, a lot of services aren't working for women to resolve their homelessness permanently, and women are falling back into rough sleeping. Integration, it's really important that cross-sector elements, the government departments should develop cross-sector strategies and programmes to make sure that women can access support as quickly as possible, no matter where in the system that they present. That shouldn't matter. We know that women might be more comfortable going to a health service or to a women's service or to any different service that might be more comfortable for them in their area, and they should be able to get that support with everything that they experience from that first access, to be put in touch with the services that they need and make sure that those cross sectors are linking, those different sectors are linking together to provide support. And prevention and intervention. We said that the government should invest in new approaches to make sure that women are provided with information and resources so that they can have some agency in preventing and resolving their homelessness. We hear from so many women that they don't know where to go, they don't know who to turn to, they don't know what they can do if they are about to become homeless or do become homeless, or face the need to rough sleep or experience violence and so on, as well as during that experience of homelessness. So we need to make sure that women know where to get support and how to access that, and that support is safe and accessible as well. So that's just a quick overview of what we've put in our Rough Sleeping Manifesto, but an example of how on a national basis we can draw all this data together and how we can use it to advocate for system-wide change at a government level, as well as those local changes that can happen and the ongoing practice that can be influenced. And just briefly, as I say, we'll be launching our report on the last women's census, so much more detail about the findings and data from that in June. So Thursday the 5th of June, that'll be an online webinar. We'll hear from the researchers from different local authorities across England who took part. We'll have quotes and extracts from women themselves who spoke to us through the census. And we'll also, it'll be chaired by Crisis. So we'll hear from lots of different speakers and there'll be a chance to ask questions and hear more in depth about all of that data and what happens with the census. We'll be releasing details this week, but I hope you can join us for that because this is just a quick overview of what we found. But more importantly, I'm going to pass on to Amy, who's going to talk about the results for the local areas for Sheffield, Nottinghamshire and Nottingham City and how it took place here, which is obviously of huge relevance and really important to understand how this data can make an impact locally and what can be done. Thank you for listening. I'll pass on to you, Amy.
Thank you. So as Eleanor has already kindly introduced me, I'm Amy. I'm a service manager for Framework, and predominantly my services work with those who find themselves sleeping rough. If you can go to the next slide, please. Thanking you. So just to give you a bit of an overview of the services that I'm going to be talking about, Framework run 3 outreach teams that cover Sheffield, the whole of Notts County, so that's 7 different local authorities, and Nottingham City. I manage 2 of those, which are Sheffield and Notts County. We all work in a very similar way. So 2 of those teams work 365 days of the year completing outreach. We all complete outreach from any time from about 4 a.m. in the morning. And the premise of that is that we go out and verify people that are rough sleeping and offer them support that they may not be aware that they're entitled to, and we verify them to the local authority because then that gives them a potentially better chance of getting some supported housing or potentially getting some kind of TA through them. We also provide a huge amount of data to each of the local authorities, and this inevitably ends up with MHCLG in terms of the figures for sleeping. So every year in October, November, we have to do the official snapshot, which is then released the February after, which gives you a national picture of how many people are sleeping in any given night of the year. As services, we don't give up in terms of the offer of support to people. So even if people don't want to work with us or tell us to go away, we continuously go back to try and engage with them to offer some stability to them and hopefully eventually get them to engage. We work in a very multi-agency way, so we spend a lot of our time working with Justine's team, Changing Futures, and lots of other teams in Sheffield to try and offer people support. And we also offer bespoke support to each individual. So if a client's telling us at that point they don't want any housing, that doesn't mean that we say we're not working with them. We'll work with them on whatever they want. So it could be around their health, or it could be around getting support for substances, or it could be as simple as getting a food parcel. So we offer whatever they ask us to offer them. Next slide, please. So I just wanted to explain that the difference between the definition that is set out by MHCLG and then the definition that Solace kindly put together for the women's census. So the MHCLG definition is very strict and rigid because obviously we're counting people sleeping rough. So they specify that that we can only count people who are sleeping or about to bed down, whether that's sitting on, in, or standing next to their bedding, or actually bedded down in open air. So that's things such as on the streets, in tents, doorways, parks, bus shelters, and encampments. People in buildings or other places not designed for habitation, such as stairwells, barns, sheds, car parks, cars, derelict boat stations, or bashers are also included. So that kind of demonstrates why a lot of women are missed. So we can't count women like who might be asleep in A&E waiting room. We can't count women who might be working on the beat. We can't count women who are potentially in McDonald's or inside the train station, for example. So Solace came up with a much wider definition to use within the census for the week in September. So this covers it in terms of having nowhere safe to stay at all. For example, sleeping outside on the ground or in a tent. Sleeping in places which are open late or 24 hours. So that would be places like fast food restaurants or hospitals, walking around all night, sex working at night, but not having anywhere safe to sleep during the day, using drugs in other people's accommodation at night, but not having anywhere to sleep during the day. Women may not do this every night, and rough sleeping may be interspersed with other forms of hidden homelessness, such as staying in accommodation belonging to unsafe, unknown people or perpetrators, staying in cuckoo flats, or staying with friends or family or associates in a very insecure or transient basis. So this could be could be nightly, weekly, or regularly, or being forced to leave immediately. I think it's really important to say that women make a decision on a night by night basis in terms of whether they rough sleep or find somewhere else to go. And we believe that the last place that they choose is the streets. And they're putting themselves in really dangerous situations where they're sleeping in squats or with punters who are not nice and are expecting them to exchange sex for a bed for a night. Next slide, please. So what we did, so Sheffield and County, this was the second year that we did it. So we've done it in 2023 and in 2024, and then in Nott City, it was their first year. So all three teams were even involved in or directly set up working groups. And we worked with lots of different agencies in each of the areas to work out how we were going to do the census for that area. So in the county and in Sheffield, we managed to put together pamper packs. So they included a sheet with lots of numbers and information for the women to get support in lots of different areas within that area. We also put things in there like lip balms and hair bubbles and sweets and drinks, and then also like sanitary products and things like that. And it went down really well. And that was to try and get the women to take part in the questionnaire, and was a bit of a thank you really, because they were giving us their time to do that. The services that were involved were really widespread. So we had like women's centres, services that work specifically with sex workers. We had shelter, we had Changing Futures, all involved within it to try and support the questionnaire being filled out within the week. In each of the areas, we adapted the questions that were kindly provided by Eleanor to make them so they were like area specific. So in Sheffield, for example, we changed the day centre so they specifically said, do you engage with Swap and Chocolate Box? And then in Nottinghamshire, we put things like, do you engage with POW? Just so the women, it was easier for the women to kind of like specifically say, yes, I engage with these services. We also, for the week, made sure that we were looking in different areas for the women. So we were deliberately looking in places like hostels, and McDonald's and train stations. McDonald's, train stations and hospitals. And we also made sure, because Framework have got a lot of hostels, that we did a bit of a data dive to see if there was any women that we could target to do the questionnaire that had recently moved into a hostel, because they would have fell within that 3-month previously potentially rough sleeping. So we tried to sort of target those women as well to see if we could get them to fill the questionnaire in. As Eleanor has already explained, there are 2 parts to that. So we did the data gathering in the week set by Solace Women's Aid, which is in September, where we did the questionnaires, and then we set up data analysis meetings, generally about a week later, to try and pull off all the data of all the women that services are aware of. Next slide. Thank you, lovely. So this slide is specifically about the data from the data meetings. So this isn't the questionnaires. And it demonstrates, like Eleanor's already explained, that we're missing huge amounts of women by being really rigid in the way that we count people who sleep rough. So in Sheffield, once we'd pulled all the data together, we had a total of 182 women who met the definition from 8 services. There were a lot more than 8 services in Sheffield, but that's how many we managed to get. We did have to remove some duplicates because some of the women were working with additional services. So once we'd done that, we had a total of 104 women who met the definition. Our official headcount for that year only found 3 women. So when you compare 3 women to 104, you can see that there's a huge disparity. We found the same again in the county. So in Notts County, we had 79 women who met the definition from 12 services. And again, once we'd removed duplicates, this dropped down to 40. However, again, the official headcount for that year was 6 women, which again shows the difference between 6 and 40, that again we're missing people. In the city, they worked with 4 services who came up with 24 individuals that met the definition. This was reduced down to 20 once duplicates were removed, and again they only found 5 women in their official headcount figure. So again, there's that huge disparity, and I hope that data helps you see that. Next slide, please. So in terms of the surveys that we managed to get completed, I appreciate these numbers probably look really low to people, but with the women we're trying to work with, this is very, very good going. They're hard to pin down. They're hard to get hold of. They're not easy to find. And they tend to present, a lot of our women tend to present in crisis rather than regularly. So it's really difficult for us to get them to do things like this. So we were really grateful that we managed to get this many. So in Sheffield, we managed to get 18 women, which was an increase from the year before. In Notts County, we managed to get 22, which was unfortunately a bit of a reduction from the year before. And because it was Notts City's first time, they managed to get 14. And it kind of demonstrates why we needed the pamper packs to get women to talk to us. Because yeah, they were very grateful for them, which was great. Next slide, please. So just so you're aware, the data that I'm sharing next is completely all Sheffield because it's what I managed to get sorted. So I will be specific and say this is very Sheffield based, but we can get you data from the others if people would be interested. So we obviously looked at demographics. So our women that we managed to get to complete the survey were mainly white British at 83%, and the majority of the age banding was made up of women who were in their 30s and 40s, and they made up 78% of people who were interviewed. Next slide, please. Thanking you. So this one shows about where women had stayed most recently before rough sleeping. So Eleanor's kind of already explained that a lot of women had actually stayed in supported accommodation prior to finding themselves sleeping rough, which demonstrates that maybe sometimes it's not necessarily fit for purpose or that the women aren't happy there. So we found that prior to sleeping rough, 39% of our respondents stated that they were in supported accommodation, and a further 39 said that they were in some kind of independent housing. So it's a really large proportion of the women that we managed to interview. We also asked them about how they'd rough slept over, or how often they'd rough slept over the last 3 months. So a third of our women reported rough sleeping every night, and a further 25% reported sleeping rough for 30 nights or more. So these women are sleeping rough, we're just not finding them. Next slide again, please. So we also ask women where they stayed in the last 3 months to try and demonstrate that they're not all just in one static location, which is how our male cohort tend to present. So when we looked in more depth, we realised that women were staying on average in 5 different types of accommodation in a 3-month period, which is quite high when you think about it. So they mostly reported sleeping on the streets, followed by staying with a stranger, which is incredibly dangerous, and I think demonstrates what lengths women will go to get a bed. Or a lot of them were either walking around all night or asleep in a car, and cars from experience of outreach, are very hard to locate and find. Yeah, that's why we're not coming across them. Next slide, please. Thank you. We also wanted to get an idea about which services the women were engaging with at the time. And on average, we found that women were engaging with around 4 services each. So predominantly, these services were places like the day centres, so women's centres. So in Sheffield, that's specifically Swap and Chocolate Box, who work directly with women who street sex work, followed by substance misuse services, and also other homeless charities. And although they did engage with the council at times, I think it's important to say that a lot of our female cohort really have a distrust in statutory services because of child removal. And therefore it's really difficult for us to get them to engage with like housing, to get through the system, to get housing. And in Sheffield specifically, because I know this isn't the same in other areas, you cannot get into any form of housing unless you go through directly through Sheffield City Council. So you can't get into a hostel, you can't get into supported accommodation, you can't get into a refuge unless you go and have a HRA with the council. So it really limits what we can offer the women in terms of their housing. Next slide, please, Eleanor. Thank you all. So we also did a split in terms of age difference, so where people had stayed or slept. So we actually did a breakdown where we looked at women who were 40 plus and then women who were under 40. So we found that women over 40 seem more likely to be in long-term accommodation before sleeping rough at 64%, and this was compared to 20% of the younger women. And that women who were 40 plus reported sleeping rough more nights than the younger women. We're unsure why that is, but wonder if the older women struggle more to find places, or that they burn more bridges, so have less options of where to go the older they get. Next slide, please. Again, we asked women in terms of the number of places that they'd slept or stayed, and again we broke this down into over 40s. So from this you can see that the younger cohort stayed in over double the amount of the women who were over 40. So the younger bracket, it was around 7, whereas the older bracket, it was only 3. So we're unsure of why that is. We wonder if it could be that there's less offers of accommodation, or that they have a more stable offer from one source, such as family and friends, but we're not really sure why it is. Next slide, please, Eleanor. Thank you. So we also wanted to find out what services women were accessing. So again, we did a breakdown in terms of the younger women and the old women in terms of what they were accessing. So younger women have a higher number of services that they engage with. So they're at about 5 each, whereas 39 plus were at around, well, close to 4 each. Women in the 40s were much more likely to be receiving support from substance misuse, whereas women under 40 reported more to use sort of things like food banks. We kind of wonder if the substance misuse services for the older women is that they're at a point where they feel they need support for that and they no longer feel able to manage it on their own, and that's why they're engaging with those substance misuse services more. Next slide, please, Eleanor. So as Eleanor explained within her slides, within the data collection meeting, we also look at sort of barriers that we experienced in that time doing the questionnaires. So the week, unfortunately, that we conducted them, we had horrendous weather. The rain was atrocious, and we felt it meant that potentially it impacted how many people we managed to engage with. There's definitely more women out there than we're aware of, and I've kind of already gone over the fact that women tend to engage with very set services, and therefore don't engage with the they tend to engage more with non-statutory services. So we really tried really hard to get the non-statutory services on side to support us to complete the questionnaires. We also found that a lot of our women who do sleep rough tend to sleep rough in couples. So in the 14 years that I've done outreach, I can count on one hand how many women we've had who've slept rough alone. They either sleep with partners or they sleep in groups with other people. They don't, sleeping rough alone isn't something women do. So that then impacted sometimes how many of the questionnaires we could get completed, because of codependency and potentially the abusive side of the relationship. We really did find that the pamper packs worked really well. Again, women in at transient, so it's really difficult for us to pin them down. We also find that they have a lot higher complex needs than our male cohort, and they tend to present in crisis, which again makes them sometimes harder to reach. As you've seen, there's a difference between the ages being broken down. One of the things that we're realising is that in Notts County, we don't have any women-specific hostels or any women-specific accommodation. That's something that maybe needs looking at. The city realised that they needed to do more planning for this year because there was a reluctance for some services to join in, I think. They needed more buy-in basically from agencies and the women potentially. Next slide, Eleanor. So what's next? So we have given all the lovely data to Solace Women's Aid, and as Eleanor has said, she is producing a report for 2024. We plan to take part again this year in 2025 and to improve from last year, and we also want to look at ways in which we can make improvements. And the final slide. So we have attempted to already make some changes to support women hopefully better. So we've changed the way in which we do outreach. So we now do check fast food restaurants, inside train stations, in A&E waiting rooms to try and locate more women than maybe we realise. We also in Sheffield were really lucky and managed to get some grant funding for a women's activities navigator, and she solely works with our female cohort around recovery, and that's a really broad spectrum of recovery, and she offers them activities to try and engage them and to get them to potentially take small steps in their recovery. We also try and drop into women's services more when we're able to. In the county, we actually now have an SMD domestic abuse worker who specifically works with our women who are on the streets and who maybe have a higher level of need. And we also hope that the data that we've collected can be used in future grants and other services that are funded for women. And I am now going to hand back over to Justine, who I think is going to give you a very quick introduction into the growth project.
Oh, I think there should be a slide that says multiple disadvantage and child removal. Eleanor?
Yeah, sorry, I'm not sure what's happened there. Let me just check. I'll stop sharing. Try again.
I can do it on mine if the error continues.
Something's got very confused. I'm really sorry.
Don't worry.
If you've got them ready,
I was going to say, yeah. Do you want me to?
Is that all right? I'm really sorry. We just did this just before, and I don't understand what they've got.
Let me just move that across. Okay. Okay, yes. So, as Amy said, and talking about the cohort that she sees within framework services and the prevalence of child removal, it was something we wanted to look at in Sheffield. So when we set up our Changing Futures system change work streams, we spoke to partners such as Frameworks and local services who support women affected by the sex industry. And the women themselves, and child removal came up as a reoccurring theme, and something that to the women felt largely unaddressed and unexplored in their experiences of being supported. And when we looked at, and spoke to them particularly about the long-lasting trauma of child removal and how it affected their interactions with services afterwards, it felt like something that we really need to dig deeper into, and also raise just genuine questions for us as services around how we approach supporting women. And what we found was that in other kind of sectors, so such as the substance use field, recovery fields, connection being the antidote to addiction, for example, young people services, the influence of friendships and peers, and in family services, the values are very much trying to work with parents to better support families and children. But we found that with women who'd had their children removed, that sort of fell off a little bit. So we really wanted to give women with lived experience the opportunity to talk about their experiences and listen and then try and act on that. So I just wanted to briefly clarify what I mean by child removal. So yeah, national legislation, Children's Act 1989, gives local authorities the responsibility of the welfare of children living in their locality. So if there are concerns around neglect, physical abuse, emotional abuse, or sexual abuse, they can intervene and theoretically ultimately remove children from their parents or carers. So this is a range of outcomes once court proceedings have concluded. So put their foster care, adoption, guardianship orders as some examples. And ultimately the amount of contact that a parent or carer, in this case women, mothers, they have with their children once this process is concluded can really vary. So some women have lesser contact once a year, kind of varying up to certain degrees of in-person visits. So we wanted to do the background research and understand the prevalence of child removal in most specifically in England. And so what we found was that approximately 84,000 children were looked after in March 2023. Removal proceedings disproportionately removed children from their mother's care because they are up to 6 times more likely to be the primary carer. And when we looked at children's social care data in Sheffield, we found that between 2008 and 2022, a total of 1,132 mothers had had children removed from their care. And of those, 17% had had multiple instances of child removal. So what that equated to over that time period was 90 new mothers, so 90 kind of unique individuals each year, and 135 kind of new children or unique children per year experiencing removal for the first time. And the most prevalent age ranges of the women experiencing removal were 18 to 24, 25 to 30, and 31 to 35, which is probably unsurprising, really. And of the women who experienced their first instance of child removal between 18 and 24, 23% went on to experience further removals across their life within the period of this data. And for so our cohort and kind of women that Amy supports, significantly disproportionately those child removals occur at birth. So Karen Broadhurst is a researcher in the UK. In 2014, she got data from various local authorities, and the data was between 2007 and 2013, and she found that 7,143 mothers were involved in repeat care proceedings over that time period, which affected a total of about 23,000 children. And we know that since then, obviously, that's kind of like over 10 years old now, that the prevalence of child removal is increasing nationally. And so her research on the cohort who'd had multiple children removed found that over half were under the age of 24 at the first removal. A quarter returned to family court within 7 years, and 40% of those women had been through the care system themselves. And when she reviewed their childhood experiences, she found that most women had experienced poverty, teenage and unplanned pregnancies, childhood trauma, and a lack of support network, along with other adverse childhood experiences. And what was evident from all of that was that this is predominantly a young cohort of women who have complex histories of abuse and exploitation, and that by the time their children are going into care, the mothers have already been repeatedly let down by public services themselves. She also talks about in her research that child removal being a gateway to further disadvantage and a trigger for an escalation of problems. So things such as kind of mentioned before about unplanned pregnancies, abuse and violence, offending and homelessness, and she found that often increased in severity and frequency post-child removal. And women with lived experience say this is due to a loss of hope and a loss of their identity as a mother, the psychological trauma of the removal itself, that being left largely unaddressed because of lack of counselling services and the lack of questioning from other services kind of working the system. So not being asked about whether they've got any children, or if they are asked, nothing is really done with that information. And that same trauma increases their vulnerability to further exploitation and abuse. And we spoke to charities such as Amy's and other kind of women's specific charities in Sheffield, and found that on average, out of the women that they supported, about between 85 and 95% had experienced child removal. And of those, 90% were currently experiencing homelessness at the same time. Within Changing Futures, the prevalence is about similar. It was about 80 to 85% of the women that we support had had children removed as well. And a significant proportion of those are some of the most vulnerable women and children in our society. And it shows about it being a systemic issue affecting women rather than an anecdotal one. That this is something that is just kind of happening to take place, particularly when we think about some of the reasons, some of the most common reasons for children being removed are linked to violence against women and girls, such as domestic abuse, or due to the trauma around abuse and exploitation that they experienced as younger women in their adolescence and childhood. So a consistent approach obviously needed across lots of organisations to prevent an escalation of need, regardless of the point at which we're intervening, whether we're intervening when that woman is, like I say, in childhood or adolescence, or whether we are speaking to someone who's later in life and had multiple children removed from their care previously. What was clear from listening to women was that fundamental experience of ambiguous loss. So their children weren't dead, so they weren't experiencing that traditional bereavement, but they were grieving the death of their relationship with their children and the loss of the experience of motherhood. So we wanted to look at, well, what support is available for women who are at risk of or have already had children removed across England. So on this map, the green dots, it's very blurry, sorry about that, I tried to zoom in. The green dots are the national charity pools. The blue dots are where areas have developed their own local charity services, and the purple blocks are areas where they have family drug and alcohol courts, FDACs. So even just from the image, you can see that it's a postcode lottery, and where there are services, there's obviously eligibility criteria, there's capacity, and demand issues. But some of those eligibility criteria that create barriers are things such as the woman's age, the amount of time that's passed since removal, the woman's contraceptive choice, if they have custody of any remaining children, stops if support starts only once proceedings have concluded, or it stops if the mother becomes pregnant again. So bearing in mind, obviously, childcare proceedings can take up to 2 years or longer if the mother is got legal representation and is fighting in court. That's obviously a considerable amount of time to not be receiving support for something that you desperately need. And this cohort of women obviously have historic as well as probably ongoing experiences of trauma and are left to navigate the family court process on their own in the immediate aftermath of removal. So, like I said, although there are specialist women's services, domestic abuse, homelessness services, substance use services, the general feeling was there wasn't necessarily a confidence in some of those services around asking about child removal, or if they did ask, they weren't particularly sure kind of what to do with that information and what to do next. And that contradicts with the fact that women were telling us about being a mother is essential to who they are, that they would do anything for their children, to the point where they will voluntarily agree to adoptions because they ultimately want to do what's in the best interest for their children. So we look at kind of the distribution of funding. Very, very little money goes into this sector, looking specifically at the impact of child removal. So in Changing Futures, we wanted to try and address that, at least build the evidence case and kind of the business case around doing things a little bit differently. And sorry, my slide the formatting seems to have gone a bit weird. But One of the biggest barriers that women also told us about was their housing and accommodation status. So legislation and statutory duties within the homelessness and social care system create barriers to reunification. So when we consider, like I said earlier, that domestic abuse is one of the leading and driving factors around housing instability and homelessness, and likely child removal is a systemic issue. So we found that some of the most common experiences where homelessness and child removal overlapped was women were under occupying in social housing and were being financially sanctioned and pushed further into poverty. And from a social care point of view, that called into question their ability to maintain a tenancy. Women who do need to go into temporary accommodation are often placed in shared temporary accommodation. As Amy said, in some places in Nottingham, there's nothing women's specific, and they could be there for long periods of time due to, national housing shortage and lack of social housing. And the temporary accommodation itself can be unsuitable for children to visit. So social workers are there in a position where they feel unable to complete their assessments to evidence that, that mother is in a position where their children or child can be returned to them. And financial and logistical pressures. So if whether they're in temporary accommodation, they've had to flee out of area. I had a client who was told that they couldn't live in Sheffield because of the risk of the domestic abuse, so they had to go to another county, but all their family and friends were local, so they can often be forced to relocate long distances and then have to travel back to see their children, and the financial pressures of that, and there's some just practical logistical issues around navigating that. And so we have a group of women who are caught in the middle of these two systems and being pulled in opposite directions. I think both would claim and want to be aspirational, certainly in terms of addressing someone's homelessness and in reunification of children with their families, but the contradictions between the two exacerbate the trauma of both. So as my final slide before handing over to Lindsay, I suppose, is the kind of the practical application of all of this research. But the final kind of thoughts that we were left with was, to what extent do we listen to and work with mothers who've experienced multiple disadvantage and child removal, and to what extent are we dedicated to preventing both? It's not only for the women that we support now, but the generation of children to come through those families. And when we look at this cohort through the lens of motherhood, it radically changes the way we approach service design and delivery. All we need to do is give women the platform to talk about their lived experience, and we need to ask the right questions and identify what really matters to them to try and create opportunities to address service design. So I just try to summarize that there around co-production, being creative, provide a platform and ask women what matters to them. And when we think about women and their experiences, they kind of say this is necessary and not optional. Lindsay, do you want me to just carry on for you? I'm happy to just keep the slides, but Lindsay from Target.
Okay, thank you, Justine. Morning, everybody. I'm Lindsay. I'm Head of Development at Target Housing. So just a very brief overview of Target. We are a charity, but we're also a registered social landlord. We've been providing support and accommodation to vulnerable individuals, couples and families for over 30 years. I've kind of always noticed that there's been a huge gap in provision for women. And when we spoke to Changing Futures and saw the stats, we knew we had to put something together. So next slide, please, Justine. So the Growth Project, it's currently funded by the Big Lottery for 18 months. It's designed by and for women, which is the most important part of the project. Before we even brought a property online, we consulted with women who'd experienced child removal and spoke to them about what support would have been beneficial for them when they were going through the proceedings. What did they not find helpful? And what would they do if they could create a perfect service, and what would that look like? From all that feedback, we used that to create the model for delivery. The core element of the project is a targeted gender-informed approach, informal and non-judgmental, and it's based around building a positive relationship. It's the first of its kind in the UK, we provide a tenancy, specialist support around child removal. It's a strengths-based approach, and it's enabled by low caseloads. So for every one support worker, they've got the support for women, which just enables the caseworkers to build up a really kind of strong relationship, and gives the time to be able to do a lot more, which I'll show throughout the next slides. So next slide, please, Justine. Thank you. Thank you. So lived experience as a foundation to service. The main themes that we got from the co-production was around advocacy, securing accommodation, getting support through care proceedings, fair and legal advice, a trauma-informed approach, and access to timely and flexible therapy. We know that accommodation services, as Amy and Justina pointed out, were historically designed for men, and women are generally shoehorned into these services. And women have stated that they don't feel safe or able to go into traditional services. So we knew that it was a targeted approach that was needed. And again, I know I'm echoing what's already been said, but this cohort of women feel let down. And it's about building that relationship up to be able to support women. So what we have been able to do is give everyone on the project access to a specialist solicitor. So he specialises in family law. He's worked with quite a lot of the women so far. They've also got access to a clinical psychologist and peer support. And the whole aim of the project is to re-establish contact with children. Next slide, please, Justine. So there's kind of three kind of main parts to growth. So we've got the accommodation, which is 12 units of dispersed accommodation. The accommodation is spread across Sheffield. There are a range of sizes. None of them are one bed, because we know that if children are going to come back to live with mum, they want their own bedroom. So some of them are 2 bedrooms, some of them are 3 bedrooms, and it's based on what is required. We've been very lucky with the procurement, so we already have stock in Sheffield, but we have managed to procure as well, but doing so in areas that we know have got low antisocial behaviour, and targeting areas where we know there's not a lot of where we'd get neighbour complaints and things like that, for example. The support, as I've already stated, it's very intensive casework. There's a big peer support element, the legal support, and we're developing some toolkits, which I will go into a little bit later on. And a big part of the project is around the psychological interventions. So we're working alongside a forensic psychologist, and what they do is they can provide one-to-one sessions with the women. They're also doing group sessions and family mediation as well. Next slide, please, Justine. So the next couple of slides are just around the referrals we've received so far. I think this really highlights what Amy kind of said around where women sleep.
Sorry, Lindsay, it was doing the audio thing, so I'll just try and get that off. I'll make sure
I can
it's not
share
on.
it, Justine. I've got them here.
Have you taken the audio?
Yeah.
Thank you.
No, it's my fault. Sorry.
So yeah, the next 3 slides are just based on the referrals that we've received, and I thought it was really interesting. So the vast majority. So first of all, we received 50 referrals within the first 3 months, and bearing in mind the first kind of month, I'd say 4 weeks was quite. We were setting things up, so we'd not fully advertised the service. And when we got to 50 referrals, because we'd only got 12 spaces, we had to close the referrals and say, unfortunately, we can't take any more because we didn't want a massive waiting list of people. So as you can see, the vast majority of women were in temporary accommodation. Some were sleeping rough, sofa surfing. It's quite a spread of where women were, and there was some in refuge and on a mental health ward. Next slide, please. So the status of child removal upon referral. So 27 legal proceedings had been completed, 8 had ongoing legal proceedings, 10 informal removals, so family, grandma, auntie, friends had got custody of the children. We'd got 4 women who were pregnant. Now, this is a big thing. We didn't want the criteria to be really restrictive. So we will accept women that are pregnant. We will accept women who still have custody of the children, but are going through the process. And then we've got 3 women who have got adult children who've been removed. Oh, thank you. And then the factors linked to social care involvement, as you can see, the vast majority, it's domestic abuse, closely followed by substance misuse, but we've also got mental health, neglect, sex work, learning disability and offending. Okay, so I just wanted to talk a little bit about the properties, because we believe that providing a high quality property is the starting point to be able to address trauma, to actually build that therapeutic relationship. So many of the women have previously accessed temporary accommodation where they didn't feel safe, didn't have any privacy and couldn't make the space feel like home with no contact for the children. So all of the properties come fully furnished, they're ready to move into, they are on AST agreements, which is kind of the most secure agreement that we could put individuals on, so they're not on licensed agreements, and there's no end date for the support, which has been a massive benefit for the women. Next slide, please. So low caseloads offer the intensive support. It's a stable home, the legal proceedings, the forensic psychologist, and then just the toolkit. So what we found is that women struggle to navigate the system. It's very complex. There's a lot of acronyms. There's a lot of even as a lot of professionals had said that they also struggle. So we are currently in the process of putting together 2 toolkits. That's one for women to navigate the court process and one for professionals. All of this is being co-produced. So we've done draft 1, took it to our peer support group. The women have made a few amendments, so that's then gone back and we're going to redo it. Hopefully within the next kind of 6 weeks, we will have it published. Next slide, please. Along with the forensic psychologist and the court specialist solicitor, we wanted to do something around peer support because we know how important it is for women to have a safe space where they can talk to individuals who've been through that same experience. So we do run a peer support group, and that's for any woman in Sheffield who has experienced child removal. They've done a variety of things. They've done yoga, they've done crafts, they've done cooking, and there's lots more in the pipeline to be done. It was just a quote around, I feel judged and hold a lot of shame after my children were removed, even by family and friends, and accessing a group with women who have the same experiences feels safe. Thank you. So we've supported and accommodated 13 women with a combined total of 21 looked after children. We've supported 4 women to attend family court, 8 women have been supported to have contact with the children, 9 women have accessed legal advice, 9 women have been supported to attend meetings with social services, and 4 women have been supported through pregnancy to access healthcare. And we've just got a video, which is one of the women that we currently support.
I was homeless a couple of years ago because I had to escape domestic violence of my son's father. So I chose to give up my home, and I had to live in hotels for a bit, which weren't exactly great. I've had social care for a few years, but I've managed to obviously complete the assessments and get rid of them quite quickly because I've had quite good workers in the past. But this time it's been quite hard because circumstances was different, obviously being homeless. Well, when I moved into the temporary accommodation the first time, I was allowed to take my son with me, but we had to be supervised when we walked in and out of the property because there was other people there that had different paths in their life that was deemed as not safe. So if you ever wanted to go out or go in, you had to be supervised going in and out the doors. So then social care looked at that as you're not stable. So if you don't have a safe place to live, even if it's through fault of your own or not, they look at you like you just can't take care of your children. So then they look at removing your children, even though every aspect of your life is perfect, other than the fact that you've had hardship and have nowhere to live. If you take your eye off the ball, it's so quickly to go under the water, and then it's so hard to get back up again. And I've gone into meetings with social feeling defeated and like a bad mom at the end of it, because they do not offer support. No matter how much you scream and cry and tell them that you need this help, they're there for the children. They are not there for you. So it doesn't matter. If you say to them, I need your help, I feel this type of way, they say, well, this is not about you, this is about your child. But you want the best for your child as well. And they make you feel even worse for putting your child in a position that wasn't necessarily your fault to begin with. I don't think they understand the amount of pressure that you put under when you have to go to meetings. And obviously you spend a lot of time looking for a house, and you go to different councils, and then it's a waiting list for a year, 3 years. So then they put you in temporary accommodation, which isn't always safe. But then that's not safe to bring your children back to. So even though you've got a roof over your head, they don't deem that safe. So that they don't understand how hard it is when you are in temporary accommodation, or after you lose a house, to actually find somewhere. And it does take a long, long time. And they give you such a small time of 8 weeks to pick your life back up and put everything back in place, and you just can't do it. And when you're having to flee certain things in life that aren't necessarily your fault, you feel like you've made a mistake, where maybe you should have stayed in that dangerous position just so you've got your son. And that's not how it should be. They should support people and offer them a safe place with children. But there's also temporary accommodations where you can't have your children there. The Grove Project makes a massive difference, because you don't feel so alone. You don't feel like everybody hates you and just wants to take and take and take things from you. The Grove Project give. And that's a massive difference when you have no more to give. They gave me the flexibility to be able to turn down 3 properties before I got this one. So they've got multiple properties that didn't work for me. But that doesn't mean they're not going to work for somebody else, but they didn't work for me. Like, I was offered a masonette, but my son he's got a massive fear of heights. So he will not walk up 3 flights of stairs. But for somebody else, that's perfectly fine, but for me it wasn't. So they gave me the flexibility to be able to go and look at many properties without turning down one and saying, well, we're not going to help you now. So they gave me the strength to be able to decide what was best for me and my child. So with the Growth Project, like say I turned down 3 houses, the social services saw that as a very, very bad thing. I should not have turned down 3 houses because I was homeless. But the Growth Project see it as, you did what was best for you and your son, and now you can stay here for as long as you want to, rather than feeling in 6 months, when I get my child back, I need to move because this isn't suitable. So they work with you long term. This is not something that you come onto and they get rid of you as soon as possible, check their boxes. Well, one of the hardest things to do is actually get accommodation. So now I've got accommodation, that's a massive tick off my list. So I can focus on everything else, like going to the meetings, having them here, you feel safe in your own space. You're not wondering, are you going to return home today and somebody's taking all your stuff, or if somebody's going to be violent or abusive towards you. It is very powerful, because you're not looking at it as, my son's gone and he's never coming back. I'm now looking at it as, whether it takes 6 months, a year, 2 years. These guys are here for me, no matter how long it takes. My son is coming home. And without these, it wouldn't be possible. I would go further and further into my depression and not go to meetings and not want to socialise with anyone. I wouldn't have this house that I have now to be able to get up every day and have pride and feel safe. So now I'm going to stand up and they're going to stand with me, and we're all a unit and we're going to be heard, and my son is coming home. He's coming home. Our home.
Thank you.
Oh, thank you all for your presentations. They were really interesting. So thank you for that. We've got a few questions. If I just start with the first one, just bear with me. So the first question I think this was possibly in your first slide, Justine. It says, could you give a bit more detail around the gender-informed strategy used to engage survey participants? Is that one from your slides? Yeah.
Not. Might be Amy's survey. No,
might be the census in general, I think.
Was it? Yeah, it's near the beginning, that one. So yeah.
So yeah, we created kind of gender informed outreach and to engage, as you say, survey participants in the census. So that involves the particular times that I mentioned, going out, changing times to make sure you're thinking about when a service is more likely to see women, changing locations you look into, again, where more likely to see women, making sure that there is a woman on each shift. So if shifts are going out in pairs, there's a woman in every single pair, so that women don't feel, women might feel more comfortable talking to women or being approached. If we, think about women being approached in the middle of the night sometimes, or any time, that can be quite alarming. Women, we really need to take very seriously that it's not a given that women will feel safe around staff just because they have a badge and belong to a service. People might have had really bad experiences, so really important that women are in those as well. There's guidance online that's got a bit more detail about those things, but they're the really core tenets of it.
Oh, thank you. The next one, Amy, was one of your slides, and you mentioned bashes, and someone's just asked, can you just elaborate on what that term is, please?
Yeah, it's a really terrible word. It basically means when somebody's made a shelter, so it's out of something like cardboard boxes, or they could use wooden pallets. It's just where they've made something makeshift to sleep inside.
Thank you. The next question is, did you get a feel for how many women who are rough sleeping have children? That was from your slides as well, Amy.
We think from the help of Justine's team that it is about between 85 and 95%. To make it clear, none of our cohort have their children. They're all in either care or custody of family members. I just want to make it clear that there aren't any children of sleeping. Sorry, that's what I just wanted to say. It's about 85 to 95%, but often it isn't something they wish to talk about. And we generally leave it to them to have the conversation with us if they wish. Some people asked us in other presentations that we've done, do we ask that question in the census? Categorically, no. We can't ask women that because it's just not trauma informed, and it's incredibly traumatizing for them to be asked if they've had children removed. So it's difficult to have a exact figure, but from the stats that we have, we think it's about 85 to 95%.
Thank you. The next question says, I come across many organisations, charities and faith groups who work with a diverse range of women. Are there any information sheets on where help and support can be provided to women that can be sent to these groups? Is there also any awareness raising for community groups around hidden homelessness for women so they can just link into the services? And that was from your second slide, Justine.
I'm not sure where you are in the UK, I suppose. I mean, in Sheffield, it is specific to rough sleeping. We had like a rough sleeping guide. So yeah, there's the Sheffield directory as well. There's the recovery directory. I mean, obviously I'm speaking to Sheffield. I'm not sure if that was a. Oh,
I think it's Nottingham, yeah.
Oh, okay. I'm not sure for Nottingham because I don't work in Nottingham. But yeah, sorry, I wouldn't know exactly where to signpost you to on the spot.
To be fair, I don't have a clue whether they did a sheet in Nottingham, because we did sheets in our pamper packs, but I don't know if Nottingham did that. So I'm sorry I can't answer the question.
I think it's a really important point out, something that I'm sure we've all found when women are telling us that they don't know where to go. It's really hard to navigate those services. So something that we hope can be, but it's really difficult when services are short-term funded and close all the time, or move or change provider and things like that. So it's actually a really difficult thing to tackle. If you have it online, it needs really constant updating, and there's no one person who knows whether this service is still existing or not. So it's a really important but actually quite a difficult thing to manage. But yeah, for the census, we encourage, as part of that gender informed idea, to services to write up sheets of what contact details and what services are around, so women can go to those services and choose the services that they want to go to when they're ready. But it's not actually an easy thing to do, but definitely we need more of it everywhere. Yeah, it's just very difficult, actually. It's important to look at.
Thank you. The next question says, where do women's centres fit into the picture, if at all? General question.
Yeah, happy. I mean, in Sheffield, we've got the Women's Project that have a women's centre, and they do a really good job of bringing in other services into that space. So they have probation officers who are usually women themselves, and have that kind of deep understanding of women's experiences, and a consistent kind of regular face in the women's centre. And I mean, obviously, Together Women's Project has that really close links with some of their offending kind of contracts across the Yorkshire region anyway. And actually spoke to the manager there, and she estimated about 90% of their women had children removed that come through their doors as well. So yeah, I think it's just sometimes like kind of bringing those spaces together. But yeah, there's always more of women's centres. Everyone just wants more and bigger and more to kind of be included in that. So yeah, I think it's one of the kind of the challenges I think for the sector are really around kind of just procuring properties and having that safe space for women to go to. It's at that one-stop shop. So yeah, I think probably various areas do the best they can with the resources they've got, and really when it comes to women's centres. But yeah, in Sheffield we've got close links with them. I'm not sure about Nottingham.
Yeah, I echo that. We work very closely alongside Together Women. They've referred a few women through to growth, and it's a very good multi-agency forum that works throughout Sheffield with the women, as Justine has just said.
Oh, thank you. We've just got one last question, which I think we've just got time for, if that's okay. This is for you, Lindsay. It says, I think you said that women are able to stay with you as long as they want. How do you manage this? Do you get pressure to improve the throughput to support more people?
So one of the questions that was asked when we initially put in funding was, how many women are you going to support within the 18 months? And I know from experience that when you're signing an individual up for a service and you're saying it's only 6 or 12 months, all they've got on their mind then is, oh, it's kind of a countdown. Oh, I've got 8 months, 7 months, 6 months. So we made it very clear that actually we're unsure how long people will stop with us. Obviously, we are wanting to move people through so we can support more. But the last thing we want to do is get to that point where we've done a really good piece of work, the women is engaging with therapy, and then they're having to move out. So it's striking a balance of it being the right time, and they will be fully supported to move on when they are ready. So because it's such early days, we're only 7 months in, it's difficult to see how it's going to pan out, but people will move on at some point. It's all down to that individual, and when they're ready, when the child proceedings have all gone through, when they've got all the support in place that they require. So that could be 6, 7 months, it could be 2 years, and luckily because of the funding we have got the flexibility to do that. I hope that's answered the question a little bit.